Hi everyone, welcome back to AusProEd. I'm Dr. Amrit and today I'm going to be sharing with you the ultimate strategy for passing the AMC MCQ exam. I have a few minutes before I head into work, so I thought let me make a quick video. So as a foreign trained doctor myself, I know exactly how challenging this exam can be. In just 5 minutes, I'll give you a complete breakdown of what you need to succeed. Let's dive in. Number 1, the exam format overview. First, let's quickly review what you're up against. The AMC MCQ exam consists of 150 multiple choice questions that you need to complete in 3.5 hours. Each question has 5 options with only 1 correct answer. The questions cover all major medical disciplines with a focus on common conditions and emergencies relevant to Australian practice. Remember, you need a score of around 50 to 60% to pass, depending on the difficulty of your specific exam. There's no negative marking in the AMC MCQ, so always answer every question, even if you have to guess. Number 2 would be your preparation strategy, I would say. Now, when it comes to preparation strategy, I would say start at least 6 months before your exam date. Create a study schedule covering all the major specialties with extra time focusing on your weaker areas. Focus on high-yield resources such as the AMC Handbook of Multiple Choice Questions. This is essential, but it's not enough. And also, the AMC has stopped publishing the AMC Handbook. However, this is still a really good resource that you should access, mainly for the topics. You'll need to supplement your resources with like John Murtagh or Anthology of Medical Conditions, Australian healthcare guidelines such as the RACGP, RCH, therapeutic guidelines, up to date. There's like a lot of excellent tools that you can access. If you can, then joining a reliable AMC preparation course will help smash your preparation 100%. I would recommend AusProEd mainly because it is the best. Number 3, join a study group of fellow IMGs because explaining concepts to others reinforces your own understanding and you'll benefit from their knowledge as well in areas where you're weak. Number 4, active learning. The key is active learning. Don't just read passively. Create flashcards, teach concepts out loud, grab your family members or friends who are non-medical and explain your learned concepts to them. Because I feel whatever you're able to teach to others will remain in your memory forever. And see if you could do as many practice questions as possible. At AusProEd, we don't focus on recalls at all and don't recommend that you do so either unless you want to keep failing your exams again and again. We've got an amazing question bank which you can check out as well. I'll leave the link below, and every question in our question bank is curated from Australian guidelines, medical journals, and a lot of thought has gone into these, a lot of effort has gone into these questions to get you references on the correct answers. Alrighty, so on your actual exam day, use the first 5 minutes to calm your nerves and plan your approach. So remember, relax, relax, relax. You have about 84 seconds per question, so timing does become crucial. Always start with a quick scan through the question. If you're confident, go ahead and answer it. But if it's a challenging question, I would recommend the elimination technique. So often you could rule out like 2 to 3 obvious incorrect options, and this improves your odds significantly. Each question must be answered before a further question comes on the screen. And once a question has been answered, you cannot go back to that previous question and change your response. So pace yourself by checking, making sure that you're doing the right thing. Don't rush into it, but obviously don't be stuck on that question for too long either. And also, I would say, make sure you're having a great time management skill, because checking the time every 30 questions would be a good thing to do, and aim to complete 50 questions per hour. I would suggest you to be aware of critical focus areas. these are your high yield areas to prioritize. For example, emergency medicine scenarios, especially like management of shock, trauma, cardiac emergencies, common Australian public health issues, preventative medicine, investigations like ECGs, blood results, imaging, like basic common things you really need to master. Ethical scenarios and patient communication is another good one. Common pediatric and obstetrics emergencies, mental health, like common topics like anxiety, depression, like pharmacological aspect of mental health. Australian guidelines for common conditions like diabetes, hypertension, asthma, all of these also, like the commonly occurring medical conditions you really need to know very well. Because keep in mind, the exam is testing your knowledge at an intern level, and the content that you must master is what consistently appears in the healthcare scene in real working life. Focusing on the common presentations in medicine will give you the best return on your study investment. Focusing on strengthening your knowledge in the commonly occurring medical problems will give you confidence to keep going. Remember, medicine is like an ocean. The deeper you go, the more there is to explore. One advice I can give you is don't waste your time studying extremely rare diseases. For now, rather keep things focused on common presentations. Remember, the AMC MCQ exam is testing your application of knowledge, not just memorization. So thinking like a doctor, practicing like a doctor that's working in Australia, consider the common conditions, what the available resources look like, and focus mainly on the local Australian guidelines. If you found this video helpful, please hit the like button and subscribe for more AMC exam preparation content. For personalized guidance, check out AusProEd.com, where we have comprehensive AMC preparation courses. The link is in the description below. Until next time, this is Amrit wishing you the best of luck with your AMC journey. Take care.